let's talk about my med school. Hi guys, if you're new here, my name is Antonia. I'm a third year medical student in the UK and I make videos about medicine and university and pretty much anything else that pops into my head at this point. So if that sounds good to you, feel free to subscribe, and if you're a returning subscriber, welcome back. So a couple of weeks ago I posted a video about how I got into medical school, just talking about my med school journey a little bit. If you haven't watched it, I'll link it up here. But in that video I mentioned the fact that I go to the University of Liverpool. A couple of people have asked me on my Instagram and have left comments asking me to talk about the course at Liverpool. So I just thought I'd sit down today and do that. I will warn you that this is probably going to be a long video, but I'll try and put timestamps for every section I talk about in this video. Without further ado, let's get into the video. I'll start off with a quick overview of the course at Liverpool. The course at Liverpool is a 5-year course, but it can be turned into a 6-year course if you choose to intercalate. If you don't know what intercalation is, I'll link my video up here about it. I talk about intercalation in a bit more depth than I'll be able to in this video. It's an integrated / CBL course, meaning that we do have lectures and lectures are compulsory, but we also have seminars. The most notable seminar being case-based learning, or CBL, but I'll talk a bit more about CBL when I get to talking about first year. First year and second year are your pre-clin years, if you will, although second year you do have a bit of clinical placement. Basically, first year and second year you've got a lot of lectures and seminars. From third year onwards, you're on the wards, you're in GP practice, you're in clinical placement, just trying to get stuck in and learning that way as well. In the old curriculum, you used to have it that in fourth year and fifth year you really didn't have very much contact with the uni as such. It was just you on placement, but they've now changed it. So third year, fourth year and fifth year you have 7 weeks each in university to have seminars, lectures, and you get some pre-placement things as well. At Liverpool, you're allowed to intercalate after your third year, either at the University of Liverpool or you can go somewhere else to do it. But yeah, that is a quick overview of the course. One component of the course that you will do literally from first year to 4th / 5th year is RS. Research is a really important part of being a doctor, and this course is run all the way through medical school. The aim of RS is to get you comfortable with the idea of reading through academic papers, looking through journals, and being able to critically appraise them, as well as take information from them. First year you have 1,000 words to write. Second year you've got 2,000 words to write. It leads up to RS3 and 4. So in RS3, the first half and third year, you have to come up with a research proposal under your supervisor, and in RS4 you carry out that research proposal. So you do whatever data collection you need to do, and then you write it up and submit it for marking. That's like the research element, just because I feel as though I might forget to talk about it in the years. Now I'll get into the details of each year. For obvious reasons, I'm a third year medic, so I'm only going to be able to talk in depth about first, second and third year, because those are the years I've actually been through, but I will try and touch on fourth and fifth year a little bit. Let's get into it. First year is predominantly lecture based, like I said before. The point of first year is to give you a good foundation of basic science, so anatomy, physiology, etc., to make sure that you're ready for all the clinical stuff that you'll learn from second year onwards. The lectures that you'll be having in first year will predominantly be science of medicine, so basically the anatomy, physiology, biochemistry of the different systems of the body. So science of medicine in first year is broken down into 8 blocks: foundation block, endocrine, musculoskeletal, cardiovascular, gastrointestinal, respiratory, urogenital and neurosensory. Each block will last 3 weeks except for foundation, which is split into 2 halves, so it lasts 5 weeks instead of the 3 weeks. In those lectures you'll get the bulk of your teaching about anatomy and physiology, etc., applied to those systems. At the end of each block you'll have a 30-question online test. It's a formative test, so it doesn't count towards anything, but it's just used to consolidate your knowledge and to make sure you've actually learnt something in the block, which I really found useful. You can be sat in a lecture hall for hours and hours on end and think that you're taking loads in, but if you don't do very well in that end of block exam, then it might be an indication that you need to revise that section a bit more. So the other main way that you'll learn in first year is via seminars, the most notable seminar being CBL, or case-based learning. Your year group will be split into groups of about 30, and that group of 30 that you're in is your big CBL group. Of that group of 30, you'll be split down into 4 groups of about 8 to 9, and that's your small CBL group. Those are the groups you'll be doing most of your seminars with. In the case of CBL, you'll meet with your small group once a block and your big group once a block. At the start of your block, you'll be given about 3 or 4 cases that you're supposed to go through in your own time. Your first CBL meeting will be with your small group, where you and other med students come together and discuss those cases and make sure that you guys all understand what's going on. It's just to pull all of your knowledge so no one's left in the dark. Your next CBL session will be with your big group, when the 30-ish of you will meet with a specialist and or a clinician in that field, who will then go through that case with all of you and will pick on you guys to make sure that you actually know about the case. Definitely do the CBL, or at least have an understanding of the CBL before you go, because it is not fun to be picked on when you don't know anything about the CBL. Trust me. Other seminars include clinical skills, so that's probably the most doctory thing you'll do in first year. You'll learn about your examinations and procedures here, for example, basic life support and blood glucose readings, as well as learning examinations such as cardiovascular exams, abdominal examinations. And it allows you to get really hands-on, which I liked in first year, but then you don't have the pressure of learning in hospital on real patients, which I know would have freaked me out. You also have CCP, Communications for Clinical Practice, and that is all about learning how to take a proper history and learning how to relate to patients. I definitely think this is where the part of medicine being an art really comes in, because there is definitely an art to the way that you talk to patients and you get information from them, because that is a massive part of the job of being a doctor. In these sessions you'll be with your small CBL group and normally a GP, and you'll just learn the ins and outs and the components of taking a history. You'll have simulated patients in, which are just actors who you'll be able to take histories from, and then receive feedback from both your tutor and the rest of your group, which is very daunting at first, but in hindsight it's probably the best way that we could have learned it, because it's not in clinical practice, so it provides you a safe space, if you will, to actually learn these skills and hone them a bit. We also have seminars and lectures on global health, so just about how you apply all the medical knowledge you have to real world populations. For example, like how socioeconomic background can affect people's ability to be able to reach and access healthcare. Then you have professionalism and ethics, where we learn about how to be a competent and professional doctor, as well as the ethical dilemmas that can arise in clinical practice. You'll have anatomy sessions once or twice a block. Your anatomy sessions will correlate with whichever block you're in. We do pro-section at Liverpool, so everything's already dissected, but you're able to get hands-on with the organs and ask any questions to the anatomy instructors who will be in with you. We also cover PSM, psychology and sociology of medicine, which is quite interesting. It's all about how mental health and certain psychological perceptions can lead to differences in clinical practice, both from the patient's point of view but also from our point of view as well. Also a good way to remind us to check in with ourselves and each other to make sure that we're okay. You get taught therapeutics as well, which in first year is mainly about how drugs affect the body and how the body affects drugs in a very general sense. Personally for me, this made more sense in second year when I could put it into context a bit better. I feel like a lot of first year is actually just learning how to process information and how to go to a lecture or seminar and take from those teaching sessions what you need to know, and not leave the rest, but at least prioritize those bits so that you can make sure that you know at least a little about everything. That's probably the biggest hurdle that you face in first year. In first year, you'll be examined by written papers, so you'll have a formative written paper at the end of January, start of Feb, just to get you used to the idea of sitting a university style exam, and then you'll have 2 written papers at the end of the year. The papers in first year are 4 multiple choice questions, which sounds great, but we actually have a style of multiple choice question called an EMQ, extended matching question, which is a lot, I can't lie. You'll have a batch of 5 questions and you'll have your options to choose for to answer those 5 questions. But instead of having maybe 4 or 5 options, you'll have like 10 options or 13 options to choose from, which is just about as fun as it sounds. It's very confusing initially, but in first year I definitely preferred that to having to actually write out answers. Moving on to second year. Second year follows a very similar structure to first year, only that the content steps up from being a more basic science level to more clinical perspective. You have the same blocks in second year as you had in first year. Blocks in second year are 4 weeks long as opposed to 3 weeks long, with the exception again of foundation block, which is split into 3 weeks that are dotted across the year. Your science of medicine lectures in second year are more about pathophysiology, so the mechanism of disease in the body. Basically, you'll learn about what happens when you get sick and how the body changes, produces certain clinical signs and symptoms when you get sick. For example, in the respiratory block, you'll learn about pathophysiology of asthma, COPD, sleep apnea, and other respiratory conditions like that. You have the same seminars in second year as you had in first year as well, but like I said before, it's more of a clinical focus. In CCP, you're learning how to take specialist histories depending on which system you're in, because the questions you'll ask for somebody presenting with abdominal symptoms are very different to the questions you'll ask for somebody coming with neuro symptoms, for example. Your CBL cases definitely get a lot more clinically based, which helps to support what you're learning in your lectures. It can be quite difficult, again, to distinguish what you need to take away from a lecture or a seminar, but you do learn how to do it throughout the course of the year. I think you just fall into a pattern, and that pattern will normally work. The main difference between first year and second year is the introduction of clinical placement. So in second year, you'll have 6 weeks of clinical placement dotted around the years. You'll be based on one of 5 hospitals around the Liverpool area. How your placement works will be dependent on your hospital site. I was in a hospital in second year where my placement was split into 3 weeks of a medical specialty and 3 weeks of a surgical specialty, whereas my housemate went to a different hospital and was on a different ward every single week. The only thing that stays constant is your e-portfolio requirements. First year, you have to do a couple of things for your e-portfolio, but from second year onwards, it really ramps up. You'll have certain things that you need to get signed off and prove that you've done in order to be able to pass the years. You'll have to take history, perform examinations, and a couple of other skills on the wards, and get doctors or nurses or pharmacists to sign that off for you, and you'll attach that to your e-portfolio. It's nice to get hands-on, and it definitely is a step up from first year, but you're not getting too hands-on because the majority of things that you'll do with patients will be under supervision, just to ensure your safety and their safety too. But it is very nice to actually get out onto the wards and to start putting in all of your CCP and clin skills and medical knowledge and applying it on the wards. In terms of exams in second year of med school, for my year, we had a formative OSCE in December and our summative OSCE at the end of the year, I believe May, June time. OSCEs are essentially practical exams where you're tested on your history taking skills, examination skills, and a couple of other skills you pick up in medical school. You'll perform these skills or take a history from a simulated patient, just like the ones you get in CCP, but you'll have to do these in exam conditions and in front of a doctor who will then assess you. We had a formative and a summative OSCE. Summative just means that it actually counts for your progression to the next year of study, but Liverpool have changed the course, so your end of year OSCE is a formative OSCE, and the first summative OSCE that you'll now sit is in your third year. My first summative OSCE, very nerve-wracking, but I survived. Our formative written papers were online, and I believe they came around end of Feb, start of March, and you get 2 written papers at the end of the year. These papers again are multiple choice questions. They'll test you on first and second year knowledge. You'll have extended matching questions just like in first year, but they introduce in SBAs as well, which are single best answer questions. The best way to describe an SBA is, imagine you have a question that has 5 options, not the 10 or 15 that you get with the MQs, but more than one answer is correct. That is an SBA. So basically you're supposed to be choosing the most correct answer, which is again just as fun as it sounds. It makes you have to think very laterally to make sure that you're actually choosing the most correct answer. And yeah, that's second year, which brings us on to third year. Third year marks the proper start of clinical medicine. From third year onwards, the majority of the time will be spent in hospital, in clinical practice, in a GP setting. You're not in lecture theatres anymore, you're predominantly on the wards. Being on placement for basically the majority of third year is a definite step up from being in lectures and on campus a lot, but it's the first time you really feel like you're properly getting stuck into medicine, which a lot of people enjoy, me included. In third year, you'll have 7 rotations. Medicine is split into 2 rotations, so you have medicine A, medicine B. Same with surgery, so you've got surgery A, surgery B, pediatrics, obs and gynae, and general practice. As there are 7 rotations, your year group is split into 7 groups to make sure that you don't have any clashes, and that group that you get given will become your big placement group. Each rotation lasts 4 weeks long, and they're split up by what we call academic weeks. We get 7 academic weeks where we're in uni, basically doing the same things that we were doing in those blocks in first and second year. Each lecture week will have a theme, so for example, child health could be a theme, cardiovascular could be a theme, respiratory could be a theme, and you'll have your lectures on that. You'll have seminars on things like personalized medicine and technology in medicine, as well as the ones you were used to before, like CCP and professionalism. But third year brings in a new seminar called CCT. Your CCT sessions will be about 8 hours long, so it's a full day's worth of work, and you'll meet with about 10 other student doctors and a GP. In these sessions, you'll get to discuss any interesting cases you've seen in the rotation beforehand, learn a bit more about the rotations to come, and also get a chance to actually present in front of your group and to the GP that you're with. Presenting to doctors and other healthcare staff is definitely a skill you need to hone. On the Friday of each lecture or academic week, everyone in your big placement group will receive a pre-placement session where you'll get specialists that will come in and just give you a bit of coaching about the sorts of things to expect to see on the ward, ward or the clinical placement you're about to go on to, and just give you some top tips that'll help you out in that rotation. Your e-portfolio becomes a lot more important in third years. In second year, you had a couple of things to sign off for your e-portfolio for the whole year just to prove that you've been engaging in placement. But from third year onwards, it becomes a lot more hands-on. For each rotation, you'll have to get signed off a certain number of histories, examinations, as well as procedures which are specific to the rotation that you're on. So for example, performing a speculum exam and a partogram in obs and gynae, or putting in a catheter when you're in surgery. Sometimes getting those things signed off on the wards can be quite difficult because everyone's quite busy, but you'll find a way to do it, and if not, you can always let the med school know. So the way that you get tested in third year is via 2 written papers and another OSCE. So obviously these things for me have been cancelled this year because of Miss Rona, but normally we would have had an OSCE around May time of this year, and then in June we would have to sit 2 papers. The papers this year are almost all single best answer questions and a handful of short answer questions to answer as well. At this point, after you've passed third year, you have a chance to intercalate or not. So like I said, I've got a video on it already, so check that out if you don't know what intercalation is. But about half the cohort will decide to go off and intercalate and study a different degree, and the other half will decide to go straight on to fourth year. Like I said at the start, I haven't been in fourth year and fifth year, so I can't really tell you all the specific. Placement wise, in fourth year you will have more specialist rotations, so you'll still have medicine and surgery rotations, but they'll add in more specialist rotations as well, such as palliative care and psychiatry. And fifth year rotations are very much geared towards getting you ready to become a junior doctor and actually practice on the wards after graduating. So as a part of your rotations, you'll have a rotation in accident and emergency and in the more acute setting, just in case you get placed there as a foundation doctor. At the end of fourth year, you also have a chance to complete an elective. Some people decide to do that elective in the UK, but lots of people choose to do it abroad so they can take a bit of a holiday as well, and also be exposed to other medical systems around the world that aren't just like the UK's. In terms of exams for fourth years, I believe that you have OSCEs and written papers again. In fifth year, all final year medical students around the country write the SJT, which is a really important exam for deciding where you actually end up practicing as a junior doctor. And by the end of fifth year, you'll graduate and you're ready to start practicing on the ward. So yes, that is the whistle-stop tour through the 5/6 years at the University of Liverpool's medical school. If anybody has any questions, feel free to drop them down in the comments or DM my Insta page. If you like this video, give it a thumbs up, feel free to subscribe, and I'll see you guys in the next one. Bye.